Okay, so the point of this evening's call is to really kind of introduce you to the new remote service at OcuPlan. It's been a really exciting time in the last 6 months. We've been growing our charity partnerships with the Macular Society and the Glaucoma Society. We've got an increased team. We've strengthened the team with James, who's one of our ophthalmology consultants from King's College in London, who specialises in age-related macular degeneration, and also has worked with the Macular Society before. We've been listening very much to what patients want and also trying to understand what works for professionals, optometrists and ophthalmologists. Yeah, it's been quite an exciting time. So just talking about the eye care landscape at the moment, it's really clear that problems are increasing in terms of capacity. Waiting times are getting longer. And the volume of people living with long-term eye disease is increasing. There are lots of new treatments as well. There's a light therapy for dry age-related macular degeneration, which is causing quite a lot of excitement and stir, and again, creating a lot of patient inquiries on the back of that, and also queries from optometrists who perform scans and wonder if a patient might be relevant for that treatment. There's definitely a bit of a funding squeeze at the moment, and sort of low risk eye care patients are at risk of that. But the thing that we've been really hearing is that there's a demand in both patients and professionals for a virtual service to try and solve some of these NHS capacity issues. And as part of that, there's been a lot of excitement about AI in terms of interpreting OCT scans and offering real-time diagnoses. So we've been running patient support groups with the Macular Society and the Glaucoma Society to really get our ears to the ground at the coalface with what's been going on with patients. And some of the stories we've been hearing are very alarming. From the Macular Society, a large cohort of patients with dry age-related macular degeneration just do not have a care pathway. The care systems are so overwhelmed with treatment disease in terms of wet AMD that as soon as a patient is diagnosed with dry AMD, that they're really kind of like pushed to one side, and they're told very little really about their condition along the lines of, well, there's nothing that can be done. In terms of the glaucoma feedback, a little bit more positive. Patients are often seen initially by a medical team, but then they're moved to virtual monitoring services where unfortunately they don't actually get answers. So they go for tests and scans, but they're often told at that consultation, oh, we can't comment on these, we can't comment on these. And that's actually creating a lot of uncertainty. So they're really looking for ways to get that medical diagnosis and that peace of mind. Talking to professionals, most consultant ophthalmologists would now agree that a virtual remote way of managing the vast majority of patients with low to middle risk disease is the only way to solve this problem. It's difficult though, because this often involves reaching out to optometrists, and most optometrists will probably tell you they're extremely busy running their businesses, trying to maintain financial profitability for their businesses, and they really struggle to have the time sometimes to sit down with patients with like dry age related macular degeneration, for instance, and tell them everything they need to know, even though that's what they want to do. And I think most optometrists, the feedback that we've been getting is that they really feel that there's a potential to try and reduce loss of vision and sight loss by education and signposting patients to appropriate care services. But what's been really striking is that pretty much most people agree that a virtual remote solution is the only way to solve this problem that we have. It's got to be easy to access, and it's got to work not just for patients, but it's got to work for the professionals, for the optometrists and the consultants, whose time is under a lot of pressure. And on the back of this, we've come up with the OcuPlan remote service, which effectively is our virtual service. We've spoken to the charities, and they've confirmed that their patients would highly value a service like this. It's creating a new pathway, particularly for those people with dry age-related macular degeneration. It provides ways to educate patients It provides ways to create continuity of care, and it also should help the optometrists in managing these patients and create opportunities for them as well in terms of recurring revenue. The remote service starts from just £150, which makes it extremely affordable compared to the vast majority of self-pay private care and private medical insurance. So it's aimed really at patients with dry age-related macular degeneration, of which I'm sure you'll see loads and loads in clinic. The vast majority of these patients have never really seen a consultant ophthalmologist due to the sheer volume of them moving through the NHS services. And what the remote service does is effectively gives them a diagnosis, a clear diagnosis, and also an ability to monitor their disease. So they'll get feedback on their scans, they'll get the ability to speak to a consultant if required, and they'll have the ability to monitor the progression of their disease in a way that gives them peace of mind. So if they've got quite advanced dry age-related macular degeneration with quite a lot of drusen, so drusenoid AMD, then they might want to have a remote service twice a year, and that's enables them to kind of manage that around their timetables and book appointments when they want to. For patients with glaucoma who often do need more regular monitoring, the remote service gives them an insight to the stage of their glaucoma and also looking for rates of progression and advice about their pressures and what they can do in terms of associated problems such as dry eye from the drops and things. So this has really come about from speaking to the Glaucoma Society patients and the age-related macular degeneration macular society patients. It's kind of trying to give those patients a service that they're looking for that doesn't exist at the moment. So in a nutshell, if you're already doing OcuPlan, then you'll know the standard set of OcuPlan tests. The only addition to that really is a sight test, either an up-to-date sight test or a recent sight test. That's reviewed and uploaded and reviewed by the consultant ophthalmologist. They have the option of a phone call if necessary. They will be presented with lots of information about managing their condition, and we try and get that information back to them within 10 days. Our aim is to provide a very personalized service, just to try and make them feel more supported. The only problem is we can't really do this unless we have the help of the optometrists. So it really has to be something that works for optometry as well in the high street and in practices. So just in terms of the call to action, effectively, patients will be asked to sign up over the phone, and the welcome pack will be delivered via the post. They'll have their optometrist visit. The consultant will review the scans and then produce a report or a phone call if required. The patient has the option to upgrade to consultant phone call or even a face-to-face meeting if they feel concerned about that. And what does the optometrist need to do? Okay, well, as I said, you're already probably doing the OCT scans, the macular and the disc maps, and the full threshold visual field tests. We are in the process of integrating AI into the system in the form of Altruis, which effectively will be free for these patients if they join the OcuPlan scheme, because OcuPlan is paying for that. So you'll have the ability, if you are able to upload all the scans through Altruis into the OcuPlan platform as well, so that we can actually look at the scans in full detail. But really what we're asking for is the same as we have now, which is the macular and disc maps and the visual field tests. We will need a pressure check and a sight test, which is normally remunerated at the sight test fee. So that provides additional revenue for optometrists. And all of a sudden, they're being paid for the tests and the sight test, and there's a potential prescribing opportunity there. So we hope that will sort of make that something that's worth your time in terms of running a busy practice. We are envisaging that a lot of patients from the Macular Society and the Glaucoma Society will take up this service, and hopefully that will create better increased footfall. If you've used the dashboard already, you should know it's relatively quick and easy to sign up to upload patients to the dashboard, and the payments are made once the scans are uploaded, just to avoid any need to keep chasing the scans at a later date. So we provide the report, which is the consultant observations of the scans and the pressures. We also give recommendations. In terms of general help and advice, so we have general advice about the DVLA. Patients often have concerns about their legalities for driving. We provide the relevant links to the Macular Society and the Glaucoma Society on help guides. And as I said, there's the option of a follow-up call or even a face-to-face meeting if patients would really want that additional peace of mind. So just focusing on the benefits to the professionals, because I think it's really important that we build something which benefits optometrists as well, because we can't offer and run this service unless we have the help of optometrists. And from speaking to optometrists about this, we get the feeling that chair time is really important in terms of like prescribing targets. And this is, of course, how practices remain financially viable. It's very difficult to remain financially viable just with medicalized type services. But I think this virtual remote service is quite exciting because it's slightly enhanced revenue in terms of a sight test and the scans. Also, the sight test is a potential prescribing opportunity, which I think is really important. And also, I mean, the feedback sometimes from the sight test can be along the lines of, well, actually, your scans look fine, your visual field tests look fine, but looking at your sight test, you know, it looks like you've developed a bit of myopic change from like a cataract formation, and that's the sort of thing you might want to think about getting a new up-to-date pair of glasses from. We're hoping it will drive a new cohort of patients because there's about 100,000 patients in the Macular Society, and quite a lot of these patients with dry AMD probably don't feel as much that can be done. So we're hoping that these patients will look at re-engaging with optometry and visiting your practice for tests, and these will be new patients. We hope it will support you in terms of actually having something to say to patients when you see them with dry AMD, like, you know, instead of just, well, there's not much we can do, or think you haven't maybe got the time really to properly sit down and talk about the stages of their AMD, that actually you would have the time to say to them, well, you know, there's this really quite good remote service which allows you to get answers about the levels and the stage of your disease. This is something we can do once a year. A couple of our practices have asked about possibly white labeling this. So if they already offer like an iPlan or a kind of a direct debit type system, it's relatively easy to bolt this on because sometimes you may already be offering the scans anyway. So you could sort of deduct the cost of the scans from that and then effectively offer them that additional OcuPlan support as well, which I think helps provide like an enhanced service really compared to some high street practices where effectively you are offering kind of medical monitoring that's consultant oversight. For patients, we think the price point is very affordable. We think it's quite significantly less than trying to seek private care elsewhere. It's an opportunity to get that peace of mind, as I said, and that control. I think control was the overriding feeling we got from the patients in the various support meetings, that they felt that they didn't really get the answers they wanted about their condition. They didn't really necessarily know how often they needed to be seen. And also, if they were sent an appointment in NHS, sometimes they didn't fit with other appointments, or they were asked to go to other centres, or they'd have kind of like a remote consultation in the NHS and they wouldn't really get the answers from that. So the fact that they get a consultant answer within 10 days, we think hopefully will make that attractive to them. So at the moment, the remote services is we've got a priority list at the moment where we're taking the details of patients who want to go onto the remote service, and we're in the process of launching that now with our charity partners and with the Simply Health group. What we would ask, please, is if you do see patients with these conditions that you do think would benefit from the virtual remote service, that you put them in touch with us, either by phone number, ideally, or with via Georgina's email. We're looking to do a soft launch over the next month. We're expecting it to be very popular, so we are tempering expectations with the societies that, you know, if we get sort of like 10,000 patients in the first month, that we have to kind of have a bit of a priority list in terms of focusing on the areas where we were already engaged with the optometrists. So, I mean, that's partly why I'm extremely grateful that you've joined this call today, because there'll be parts of the country where, you know, the demand is probably going to be quite high. And they might not necessarily be some of the core areas where OcuPlan is popular. So, you know, it's very popular in the West Midlands, Worcestershire, Birmingham, where I work, and growing popularity in London as well. But, you know, there may be parts of the country that are not well served by face-to-face consultant opportunities. And we expect there to be sort of interest into OcuPlan in those areas as well. So it's much less geographically bound than the current OcuPlan service, in terms of you effectively, your patients will be getting a consultant review done by myself, done by James, some of our senior consultant ophthalmologists, which is going to be rapidly turned around in about 10 days. And that is it for today. So relatively short talk, and I can hopefully open up to any questions.